about us.
All right. Hello, hello. I got a little more energy today. We were off last week, so I'm excited to be back today with you guys. How do I look? Roel, what's going on? D. Lynn, hello. Great to be with everybody tonight. Leanne, thank you. Let's see. One step forward. Thank you so much. Thank you for listening. I love that question around hydrogen water and hydrogen pills. If you're new to the show, let me know. I believe we're live on Instagram as well. I see you, Bianca. I see you, Chad. RDBO. What's going on, Lisa King? Great to see everybody over there. All right. I see my brother Tom is in here. Yeah. Yes, you can see I got a little sunburn. I was in the Caribbean. It was awesome. I did not lift today. In fact, I did not lift yesterday or today. I'm a little under the weather. I think, we're in East Tennessee. Could be a number of stuff. So I do have my coffee cup here. If you guys want a coffee cup, let me know. They're all over the place here in the North Knoxville office. Got tons of these things. Thank you, Mom. I see Foxy Moxie's in here over from New York. Great to see you. Let's see here. Doc is on his way. RDBO. I am not a doctor. My dad is. He's a family doctor. He's going to answer questions tonight. Dr. Rogers is a family physician turned kind of functional medicine, integrative medicine practitioner, board certified in anti-aging and all that good stuff from the American Academy of Anti-Aging. Thank you for asking, actually. We don't talk enough about that. I am the host, and I work at Performance Medicine with a bunch of people that's probably in here tonight. I'm excited to get to see all my family in here. But family doctor, it's a great question. Dr. Rogers is a family physician. Any other questions around that? I think that's a good question. I appreciate that. Thank you, Stan. April, I cannot wait to see you. It's so good to see you. It's been a week, and I can't handle that. I can't handle a week. We can't make it that long. I'll hopefully see you here soon. Let's see, Katie, what's going on? It's been too long since I've seen you too. I'm so glad to be back. Goodness, you guys did such an amazing job over the last week. Things at Performance Medicine are just incredible. You guys just do an amazing job. So thank you. And I'm excited to be back. I was a little worried, like maybe they don't even want me back. But I hope you do. Carter, what's up? So good to see you. Happy Tuesday to you. This is, for those who don't know, I get to interact with a lot of our team tonight. We have offices in the Tri-Cities and in Knoxville. So I don't get to see everybody every day. So this is nice. Montana's in here. She's in our West Knoxville office. I got to see her last week and a half ago. It's good to see you tonight. Let's see. Who else we got? I got you, Foxy Moxie. Thank you. See, Ivy's in here. Thank you so much from our JC office. Happy Taco Tuesday. Thank you, Katie. I missed you guys. You guys. I'm so happy to be back in the swing of things. I'm happy to be back with everybody here watching. As you guys know, I hate missing these Tuesday nights. These are kind of therapeutic for me. I love doing it. We love answering y'all's questions. So thank you for being with us. Today on the podcast, we've had a couple different podcasts come up over the last few weeks. This was with Dr. Susan Creech, our dentist friend who is amazing. She might be here with us live tonight. Salivary testing They go over a couple different salivary tests that are really, really cool. We also did an episode with her last week around, I believe it was oral cancer screenings. And then we had our North Knoxville provider, Bo McGregor, who I get to hang out every day. Bo, I love you, man. I hope you're watching. And my brother Andy, they talk about the GLP-1 myths. Lots of myths around the GLP-1s. They debunk all of them. So if anyone has any questions around Ozempic, Mounjaro, tirzepatide, semaglutide, watch this episode. It's short. It's about 20 minutes, and they go through all of it. And then in our newsletter, if you guys aren't subscribed to our newsletter, make sure you do. It's Performance Weekly. You can find that on our website. We reposted this, Methylene Blue Revisited. It's one of our most watched videos of all time. Dr. Rogers goes over everything you need to know about methylene blue, of which I'm taking a ton of right now. I took 3 methylene blue. All right, Doc's ready to roll. What's up?
Hey, Ben. How are you?
So good to see you. Have I seen you since the honeymoon?
How's married life?
It's awesome. You know, it's really cool. It's only been a week. If anybody has any questions for me, I got all the advice in the world for you. Specifically, Ben C is about to get married as well. Ben C is getting married here. If you have any advice, Ben C, let me know.
We're having a National Ben Day on March 7th. March 7th has already passed, isn't it?
I can't believe I missed that.
Yeah,
I cannot believe it. I see Barbara's got a great question. Thank you, Barbara. I see you, Mark. So good to talk to you, man. Thank you for being here. You ready to rock and roll? Was your day good?
We had a great day. Saw a bunch of good new patients, and yeah, it was a wonderful day. Wonderful day. How about you? You sound like you have a cold, Ben.
I got a little bit of a cold. I was before you hopped on. I was telling everybody I'm on the methylene blue heavy right now. I'm taking 3 of the NeuroPro Pluses per day. I think that's 45 milligrams. 45 milligrams.
I think you've lost your strength and immunity since you cut your hair. Kind of like Hercules.
I might have to be
for the wedding. You had to for the wedding.
I had to. I might have to grow it back out for a bit. I see this. Oh man, that's so cool. Thank you, Mark, for the kind words. For the Kingsport office, who does such an amazing job.
He always brings us the greatest stuff. I mean, just incredible. Just world of knowledge, and he also brings us these healthy treats to eat too. So he's very nice.
I love it.
Notes and stuff.
I love it. We're gonna hop into the questions here. I see you, Abby. I see you, Linda, over there on Instagram. Thank y'all for hanging out. Let's jump in here. If you guys got a question for Dr. Rogers, we're going to get to the live portion of the show here shortly. Let's start with this one. I love this question. I remember a while back, Dr. Rogers saying something about signs of being diabetic if your morning temperature drops below 97. Will you ask him what it means if it does drop below 97? And for some context, I've kept a log of mine for 2 weeks now, and it has been 97.1 before, but mostly 97.5 to 97.8. Is that a good waking body temperature for a female in early 50s? This is a great question. Let's answer this one first.
Yeah. Well, it's not signs of diabetes. It's signs of a low thyroid. It has nothing to do with diabetes. I don't know if you misheard me or what, but yeah, it's suboptimal thyroid function. Your thyroid is the main regulator of your temperature. There's other regulators as well, but in your brain, but it's thyroid. So if you average below 97, you probably have a suboptimal thyroid, despite what your thyroid labs may show on your lab results. So yeah, in the early, I see a lot of females perimenopausal that develop hypothyroidism. So make sure when you get your thyroid numbers checked, which you should if you're in your early 50s. Hopefully you're keeping an eye on them and replacing your hormones with bioidentical hormone therapy. Ask them to check your free T3. That's the main one, but also check a free T4 and a TSH, sometimes a TPO. Just depends on sometimes we'll dig deeper, but check your thyroid. If you're told they're normal and you have other symptoms of hypothyroidism like weight gain, thinning hair, dry skin, constipation, cold hands and feet, then you need to treat. You need to treat that and get an optimal level, not just a normal level, an optimal level. So it could be you're on the borderline.
That is a great question. I hope that offers some clarity there. Thank you for sending that in over email. This is another question that came in over email. Can a woman in the mid-40s with symptoms have normal hormone results and still be in perimenopause? How do you treat hormones during this phase with so many fluctuations? I love this question.
It could be. That's why, because your hormones in a woman in your mid-40s, that's the toughest time because unlike a man whose testosterone's the only one they have to worry about, really, they just kind of slowly come down evenly. Women have 4 hormones that cycle. They don't drop off at the same rate. They may, kind of surge, drop off, surge. So sometimes you have to check it a few times. If you have normal 28-day cycles, try to check it between days 19 and 23. Your first day one's the first day of your period. So that's very important. And, I guarantee you, you're having some hormone imbalances. So usually in that age, your progesterone's probably going to be relatively lower than your estrogen levels. So it's that balance that brings you, peace. And so you may also have a low testosterone level. So get it checked again. Normal doesn't mean a lot. It's the ratios and the timing of when you check the blood or salivary testing. So it's just a tough time of life, but usually I end up putting them on progesterone, natural progesterone, and it really sometimes just for the second half of the cycle at that age. So it's tricky. You have to know what you're doing with hormones. You can't ignore women though, because they need early replacement of your hormones. It does the most good. But gosh, I saw a woman today in, mid-70s, I'm going to put on hormones. So it's not too late, but certainly to avoid a lot of the bone loss, the cardio protection, mental protection, start early. Because you can really have some, even though they look normal, they can be abnormal or not optimal, especially the ratios between estrogen and progesterone.
Is it more complicated to get the diagnosing right or the treatment, or are they both kind of complicated and kind of go together? Because it seems like, to diagnose a hormone imbalance is way more than just, checking estrogen levels or testosterone level.
That's why you have to talk to your patients.
Yeah.
Numbers are numbers, people are people. So you treat patients, not lab results. The lab results sure help. So, it just takes a lot of study through the years, a lot of experience. It's not something they really teach, so you have to go search out for it. And there's a great deal of literature, and people are getting more used to it, and they're beginning to realize that women need hormones, and that bioidentical hormones do not cause cancer. They do not cause heart disease. They prevent it. So, but you have to know that, and you have to know which ones to use. So I would say equally, you need to know as much.
Yeah.
Unfortunately, most doctors, even GYNs, they should be the ones doing a lot of that, but they're not knowledgeable enough, or they're jaded, or they've read the WHI study from 2003, and they go by that disputed, terrible study that misled everybody and denied a whole generation of women these life-changing, saving hormone therapies. We did a shout out on International Women's Day this past weekend. The fact is that women live 7 years longer than men on average, yet that 7 years that they live longer, they're not healthy. Women are more unhealthy in old age than men are. They suffer from way more autoimmune diseases, way more dementia, 4 to 1, osteoporosis, fractured bones, um, fatigue, depression, all that. And a lot of it's because of lack of estrogen.
Mm.
If a woman goes into menopause after age 53, she will live longer. She will live 7 years longer than a woman who enters menopause at age 43 or even
Wow.
45. I think 45, and it's because of estrogen.
Is there a way you can delay menopause in a woman?
Some of it's genetic, some of it's environmental, some of it's bad luck. Some would consider it good luck, no more periods, but it's bad luck if you don't replace your hormones. But all you have to do is replace your hormones.
Mm.
Unless there's a real odd reason for ovarian failure early on. I've seen cases of that. That's why we check luteinizing hormones, follicle stimulating hormones. I mean, you have to know what you're doing and look at those things. And unfortunately, not many doctors are well versed in it.
Is so interesting. What a great question. I see Robin Riddle is in here. Robin, it's so good to see you. We're gonna be recording here soon. And speaking of that, Robin, D. Lynn watched the video on castor oil. We didn't explain this on castor oil that I thought was interesting, and a lot of people on YouTube did as well. And it's like the kind of the new thing in functional medicine. The functional medicine world is castor oil. So thank you, Robin, for being here tonight.
That. It was a great summary. It's fantastic.
I love it. D-Lynn, thank you for watching as always. I see your question. Thank you. We're going to get to that in just a second. Anna, thank you so much. My brother Steve's in here. Steve, what's going on, man? All right, we're going to keep going. If you guys got a question for Doc, go ahead and put it in the comments. This is a bone health question. Because I'm working on bone health, I was told to use a collagen specifically with Fortibone. These are hard to find. What makes Fortibone different than just type 1 and 3 hydrolyzed collagen? So this is a round collagen, and then there's a couple more questions as well.
That's a good question. Basically you have 3 different types of collagen. There are others, but the main 3 you worry about are types 1, 2, and 3. And type 1 collagen, which is the most abundant, is really for bone and skin. A few other things, but mostly think bone and skin for type 1 collagen. Type 2 collagen is really for cartilage, specifically cartilage. Type 3 is for more skin, hair, nails, blood vessels, and maybe some internal organs. There's some of that in type 1 as well. But so Fortibone is one that just specifically focuses on type 1. And there have been some studies, small studies, that show that when they've compared bone density studies, that it improves. So it's not the normal one you see, but I've had some patients to take that, and they like it. You have a lot of collagen in your body, and you really need to take care of it. I take collagen. The one I take is called keto collagen. I like it because it's, and most of them are bovine, as this one is, but I'll tell you because it has MCT oil in it as well. But it's type 1 and 3, and it's a keto, so it won't break your fast. I try to fast every morning. So, but Fortibone is type 1, and supposedly it stimulates another mineral called hydroxyapatite. That is a thing. It's a mineral that I like because you can actually use it in place of fluoride for your teeth.
Yeah, I was about to say that came up in Dr. Creech's episode.
She's got me some toothpaste that has hydroxyapatite in it because I don't use fluoride. And thank God they're finally taking the fluoride out of a lot of these cities' water supplies. Utah, the whole state just took it out. I assume there's going to be more people following this. I'm not much on fluoride, to be honest with you. I think
Interesting.
all these dentists have been brainwashed about fluoride, I think.
That's so
Not to say
interesting.
it does prevent cavities. At least there's a 25% reduction in cavities, which is a very low number for when you're talking about brain development as well that could affect it. And the thing is, you don't know how much is in your city's water supply. I've looked some of them up, and they're usually over the recommended limit.
It's too much.
So, yeah, and so hydroxyapatite, Dr. Creech taught me you could use that, and it's great for your bones, great for preventing cavities and strengthening your teeth. So, I like it. Some of the facial fillers also use hydroxyapatite in them. So type 1 Fortibone, I'm all for it. A lot of times you'll get combination that has a lot of them. AlgaCal makes it. They do, and they have. I think AlgaCal may have several other different. I think AlgaCal may have Fortibone and some of the other specific types, 3 or 4 in there. So see, look at your bone density scans and compare them. And remember, you don't need extra calcium. I don't like extra calcium supplements. I like D with K. I like exercise that includes, weightlifting and I also like bioidentical hormones when you get to that age. I don't think there's anything better than bioidentical hormones for strengthening bones, but certainly follow that. You don't want to break bones. You don't want to get brittle. So good question.
This is from Carter here. A toothpaste brand that Dr. Creech is recommending. Do you remember?
I'll get that too, Carter. I'm not really sure what the name of it is. I don't. It doesn't come to the top of my mind, but I'll get that for you.
All right, we will get to that. Okay, let's go to. Excuse me. This is around the third-party results, third-party testing. Goes with the last question. Where can I find third-party test results for various collagen powders? There seems to be a lot of questions around the purity of collagens lately. How are you looking at this when you're looking for collagen?
Yeah, I just get a trusted brand that I've used, or in going to some of the conferences, talk to the reps, and I always look at the ingredients on them to see if there's a bunch of chemicals in there. But to really test something, that's a toughie. You're going to have to find a university or maybe a chemist. I've actually had a couple things tested, not collagen, but I've had some things tested by a couple of chemists that I know that I wasn't sure of the purity. And one of them was 100% pure. That was when I had fenbendazole tested from the company in Florida that I tell people to order it from. And the other one was somebody got what they thought years ago was HGH from Mexico off the internet, human growth hormone. So they didn't think they were getting results. So I actually knew a chemist at the time who had a mass spectrometer. It wasn't HGH, it was HCG. It was completely different. So they were getting ripped off. But certainly, you got to be careful. You really do. But I don't know of any way other than taking it to a university, or if you know a chemist that has the resources to do this, how you're really legitimately going to do it. And that's a good question around a lot of these supplements that are, especially the ones like I was seeing an article on Kratom, which is you see them sold at every gas station, and it's really from a plant, I think, in Southeast Asia that makes powder out of it, and it supposedly can help pain. It can act at low doses as a stimulant, and the high doses as a relaxant. But apparently, most people use it for pain, and probably these kids use it to get high or something. So there's been a lot of deaths with Kratom, and there's no regulation of it. It's sold at gas stations.
Wow.
Potentially, if it was studied and put out by a reputable FDA approved facility, it could be good, but you're risking your life taking this stuff from the gas station that comes from Southeast Asia that can potentially cause you to die if you took too much of it. And sometimes these kids, it makes them feel good maybe, and they overdose on it. Kills them. So be careful.
Yep.
Be careful.
I love this question. Thank you for sending that in over email. I'm going to put this up. I'm seeing Robin put up this for the, I'm assuming, Robin, this is for the hydroxyapatite.
Boca.
Boca as the brand.
Yep.
And Barbara, I'm assuming this is hydroxyapatite, or this could be collagen. Barbara, Native Path. So thank you for putting those in, guys. Okay, this is a ivermectin question. Let's see, just came in. I'm inquiring for a friend that has been diagnosed with stage 4 cirrhosis of the liver caused by Graves' disease. She's a non-drinker. Would ivermectin possibly be helpful in this situation? What's your thoughts on this one?
I've never used it for that. I'd be afraid to recommend it, to be honest with you. We use ivermectin for a lot of metastatic cancer to the liver, but when you use ivermectin or Fenbin or any of the antiparasitic drugs, you have to monitor the liver if you're going to use it long term. So wow, that's a toughie.
Yeah.
State that you just don't see that much. Cirrhosis of the liver is a major driver of liver cancer. So she has an probably had autoimmune hepatitis, probably coming from overlap with Graves' disease. But autoimmune hepatitis, I had a patient last week that has it, doing great, but certainly requires some heavy hitter treatment. So I'm going to leave that to her hepatologist, because I cannot recommend for that for her right now.
Well, we always appreciate questions like this on behalf of friends. So I hope that's helpful. But Doc, I appreciate that. Like we always say, if we're not just going to answer anything that we don't feel comfortable answering, and this is one of them. So thank you for sending this question in on behalf of your friend. This next one here is around Ozempic. Do you guys do Ozempic compound in pill form for someone who hates shots? So as you guys probably know, Ozempic's in a shot form. What's your thoughts on this? How would you kind of talk about this?
Do we not, of course, we don't compound in our offices. We write prescriptions, and certainly you can get compounded oral semaglutide, and from my experience, it doesn't work too well. We've prescribed it for some people through different compounders. A lot of them make it the oral semaglutide. It's a daily rather than a weekly formulation, but just haven't gotten the results from it. I don't know if Robin chime in here. I don't know if she has either. I just haven't seen it work very well. In theory, let's give it just clinically, I don't get success from it. Supposedly they're going to try to come up, I think Lilly or Novo is trying to come up with an oral weekly form of a GLP, GIP, that maybe work better, but I just frankly haven't had success with it.
Would you say berberine for a patient like this, possibly?
Yeah.
Or
yeah, I had a patient today who just did not want to. No good result for weight loss. Okay, good answer. Yeah,
can help with A1C. Interesting. Thank you,
Robin. I like berberine. I put a guy on today who did not want shots. He got to use semaglutide, but so I put him on berberine, dihydroberberine, which is the best form of it, which some people call nature's Ozempic, but it will help you, but it is not a replacement for the weekly shots. It's not as near as potent as that, although it's a good supplement. But
yeah,
you're not going to, for people that are really obese, you're not going to find the results from it.
Great question. Thank you guys for sending those in throughout the week. We're going to get to the live portion of the show. Let's put this up from Robin. Thank you, Robin. An Akkermansia-based probiotic can help increase GLP-1 naturally too. Super interesting. Thank you for that comment,
I'm
Robin.
using a lot of Akkermansia probiotic for people for their guts that I can't help otherwise. I got that tip from Robin. It's, bloating, gas. I've gotten some pretty good results from that.
That's interesting.
Yeah, I've got a lot of people that really like that probiotic.
Thank you, Robin, for that. Guys, we're going to go to live questions here. So if you have a question for Dr. Rogers, go ahead and put in the comments. I'll start up with One Step Forward on YouTube. And if you guys, I see you guys are on Instagram as well. Celeste, how's it going? So good to see you. If you have a question for Doc, go ahead and put them in the comments over there. I'm looking at Instagram as well. One Step Forward. Thanks for the podcast. Thank you for listening. Have you ever heard of hydrogen water and hydrogen pills to make hydrogen water? If so, what are your thoughts? So I'm assuming this means hydrogen pills to make hydrogen water.
They are, yeah. Or you can buy one of the bottles that generates it for you, generates hydrogen. I have one of those Gary Brecka things. Supposedly it gives you, by adding an extra hydrogen to your H2O, it's supposed to give you energy. And, I make one every morning. I don't know. I really can't tell you for sure if it's made a big difference. But the little pills you just dissolve generate this fizz and put a little extra hydrogen in there that's supposed to be kind of beneficial for mitochondrial health and maybe pumping out more ATP. If anybody out there has had dramatic results from that, let me know. Nobody's told me it's a life changer. But I think Gary Brecka sold a lot of flasks from that gig.
Let us know, guys, if you have, because we do get a lot of questions around hydrogen water, and it's a very hot topic. Robin has tried the pill version. I'm assuming this Robin is with the hydrogen water, so not feeling anything from them. It's a great question. Let us know in the comments, guys, if you've seen any success with it. All right, I'm gonna get to, let's see where I was. Such great comments. Thank you, guys. I know I'm missing one. Let's go to Roel. I'm feeling the same, Ben. So seems Roel's feeling a little under the weather. I was going to ask your dad what to take for aching muscles. What's your thoughts for aching muscles?
Roel, that's a great question. I want you to go down to your local gas station and get something called Kratom.
Oh, no.
I hope you're laughing, Roel.
Yeah, no, that's a no.
Please do not do that. I'm just joking. I hope you've been on here listening about Kratom. Me talking about Kratom, Roel. Do not do that. Certainly I like turmeric. If you're really aching, break down and take some Advil, some ibuprofen or meloxicam or something if you want. You can really get some achy muscles. And one good thing that I do, I get in my hot box. I get in my infrared sauna. I get in front of my red light. I drink a lot of water. Tylenol doesn't seem to help much. I'm really not big on Tylenol. But the other thing that I've done is take an Epsom bath, salt bath. That helps me as much as anything. I love it. Magnesium.
Yeah.
So try those and you'll get over it. It's your body's on way of kind of generating a little heat to get rid of the virus.
Roel, keep us posted with how you're feeling, man. We hope you start to feel better soon. Let's get to Foxy Moxie over in NY State. Is your NeuroPro methylene blue? Is it a pill form?
Yes.
I'll let you answer that.
Yeah, you can answer it since you're taking it. I'll take it too.
I'm taking it.
It's a pill form, so you don't have to put all the drops in and all get a blue mouth. You're still gonna have blue urine, but yeah, I've really rotated over that. I've rotated over that than mixing all the methylene blue. So.
But Foxy Moxie,
there's 16 milligrams in one of the pills, so It's a good dose too.
So NeuroPro is methylene blue Foxy Moxy. Thank you for that question. And they're pretty small tablets.
Very small.
Okay, let's keep moving here. Thank you guys for the questions. If you have a question for Doc, go ahead and put it in the comments. I see Barbara over on Facebook. I have hypertrophic cardiomyopathy, and I have muscular catches in my back. Is it okay to take muscle relaxants with this heart condition? I've done physical therapy and continue to do the exercises, but I'm still getting the catches. What's your thoughts on this, Doc?
Yeah, I think it'd be all right. I don't think it'd be contraindicated. You might want to use a mild one like Scalaxin that is more mild than something like Flexeril, Soma, that type of thing. And it won't make you drowsy either. So, if you have muscular catches in your back, see a physical therapist and let them evaluate your spine. I also have this. I have a pretty bad lower back with a lot of scoliosis in it and a lot of degenerative disc disease, and that's helped me more than anything. And I've had my back injected and all kinds of different treatments. I have a TENS unit that I occasionally put on there. Sometimes I put different rubs on it, like CBD rubs and things that seem to help a little bit temporarily. I have a Theragun that I really use for muscular spasm. Really, with most back pain, it's the spasms that are hurting. Unless you have sciatica or a disc that's impinging a nerve, it's usually spasms that cause pain.
Yeah,
bad spasms, bad.
Do you remember that picture? Kelly was having some spasms and she was like stuck in a position.
Yeah.
It really is. It's debilitating.
Yeah.
So Barbara, I hope that helps a little bit. I hope, I hope you start to feel a little bit better with this. I know that's no fun. That is no fun. Thank you so much for asking that question. I know that helped more than just one person. Jody, I see you, brother. Thank you so much. Coal miner's daughter. Thank you. You guys are the best. I love you guys. Okay, let's keep moving. If you guys got a question, go ahead and put it in the comments. I see Max. Thank you, Max. March 3rd, I had small intestine resection surgery and lost 35.5 inches of intestine. Biopsy results said they were inflammation like my bladder surgery. Thank God, no cancer. Doctor recommends taking Simponi more often than every 2 months. Today, my arthritis doctor was going to call my gastro doctor to discuss about it. On the side, do you think I need to take ivermectin to help me to lower the inflammation? If so, how many milligrams and how often? Without surgery and biopsy, it looks like tumor. And let's see here if I'm missing some, Max. I think. Okay. And got out of the hospital on the 8th. And once recovered, I will visit with Robin to talk more about it and take my last 4 lab results. Well, Max, thank you for this question, man. We're going to be praying for you. Let's get to this one here. What's your thoughts, Doc?
Wow, that is interesting. And you do need to talk to Robin because, you may have a short gut and, you're really going to have to maybe look at your gut microbiome and get that straightened out. So you just had, I wonder if you had, it's interesting if they put any diagnosis on that. If you're seeing an arthritis doctor and you're taking a kind of a biologic drug that may help your gut as well if it's inflammation. I'm just not sure if, that's the second question I've gotten tonight about ivermectin.
Yeah.
Ivermectin helping certain conditions. And I'm not sure I could recommend it right now for you. Certainly don't do it until you talk to Rob and let her look at all the stuff and maybe analyze your gut a little bit. But I don't think I would take that right now.
So no diagnosis, just inflammation is out of control.
Okay. So something caused that inflammation and, it wasn't infection. When you use a biologic, you're more predisposed to infection. So you need your gut straightened out. And I'll tell you, Robin Riddle is the best person I know to help do that way better than your gastro doctor.
Yeah.
And of course, talk to your gastro doctor about taking a Simponi more often, because that may have overlap there in treating autoimmune. I'll tell you one thing I would think about, possibly, and you can talk to Robin about this, is low dose naltrexone. That would probably help you. But make sure, don't take it yet until you talk to Robin about it. She goes over all the stuff. But my guess would be that would be something that I would consider if it's any kind of autoimmune disease, and it seems like it is. I don't know if so. You didn't have cancer in your bladder, just inflammation. Really interesting. Interesting note here. You know the only FDA approved use of methylene blue is?
For the poisoning that can happen in the hospital.
Well, that is another one, yeah. But for carbon monoxide poisoning and cyanide poisoning, IV, yeah, that's true. But it also, some people use it for interstitial cystitis.
Huh.
Interesting. But I hope you do well with that. You will do well with it, but you got to calm the inflammation down. You really have to go on a great diet. I don't know what type of diet your gastro doctor's going to recommend for you, but I would take Robin's advice over any GI doctor as far as diet or gut health, to be honest with you.
Yeah.
That's not cutting them down. They don't know much about it, to be honest with you. As far as, what you should be eating, I don't think. They just treat it with medicines and scopes and surgeries, and they usually don't consider it. I'm not saying all of them do this. Most of them I've met, interacted with, they don't really focus much on it. They don't focus on the cause. But talk to Robin. You should do fine with that, but take those under considerations. Don't start ivermectin yet.
Max, thank you for being here, brother. Thank you for the question. I hope that helps just a little bit. We're going to keep going here. Thank you guys for all these amazing questions. Let's get to Jen. Let's see if I missed somebody. Okay, cool. And I see D-Len. I got you. I have a family member who's been diagnosed with MDS myelodysplastic syndrome, TPF.
You messed that one all up, Ben. Myelodysplastic syndrome. That is a tongue twister, isn't it?
I was trying to pronounce it out for Mark, and I botched it. Myelodysplastic syndrome.
Just call it MDS. Just say MDS.
MDS TP53. Any alternative or complementary treatment that helps? Thank you very much. Thank you, Jen. What's your thoughts on this?
That's one. Again, that's a heavy hitter, and you probably need to go by what they tell you, because I don't know anything about TP53, specifics. I'm not really qualified to tell you, what medicines work for that. But another thing I would think about after you get the advice of the doctor who's going to treat you for that is possibly LDN. That's another one that may help that condition. And we may consider using ivermectin for that at a later point as well. But you need to see what the treatment plan is before you go to a functional medicine doctor or an integrated medical doctor, which is more what we are, with all the ins and outs of what you have and what their treatment plans are for you. That's a heavy.
That's interesting. And that's probably something we need to talk more about, is like, the progression of things, like going to a specialist first, then to an integrated medical doctor, or vice versa. Just what that process is. I think that'd be helpful for a lot of people. So thank you so much, Jen, for that question. I see Angie's in here. Angie, what's going on? Great to see you. Thank you. Okay, we got some questions here. I'm going to get to D-Len. We're going to keep it moving here, guys. Thank you all for all the questions. There we go. What's your thoughts on this for D-Len? Is it
No,
too late?
no, no,
Yeah.
not at all.
For the audio folks, is 66 too late to start hormones? And it's an emphatic no. Thank you, D.
66 is a new 46, is
That's
what I
right.
say.
That's right. That's right, D-Lynn. Thank you for the question. We're going to keep going here. See if I can find where we are at. Debbie, I'm glad you're here. It's so good to see you. Okay. So there's a cyclone here. She's in Australia. Internet is unstable. Thank you for being here throughout all this, Debbie. Very stressful time. Can doctors suggest anything to settle stress, anxiety? Yeah. What's your thoughts on
Yeah,
this? Seems like they're
yeah,
going through a lot down there.
yeah. Probably being a family doctor for almost 40 years, probably what comes into my office, stress, anxiety, is about half of it that really, whether they're there for that or not, it's so prevalent in what we treat, and causes real disease. But yeah, there's all kinds of prescription medicines you can get for it, which I use at times for people because some people need it. I mean,
Mm-hmm.
some people have to take a Xanax every day. Unfortunately, they have to take a Xanax every day. Very habit forming. Or Ativan or Klonopin. I try to get people off that if they don't need it. It's a slow weaning process, but I like the herbs on that, Debbie. I like, we even have our own stress formula that works really good. People love our stress formula. Has herbs in it that really work well. L-theanine, ashwagandha, saffron. Those are the three I put in there. And I think together they work well. If you have a lot of mind chatter, can't get to sleep, L-theanine is great for that. If you have high cortisol levels, ashwagandha is good for that. Saffron is just one of the all-time great herbs for a bunch of stuff, including, I put a lot of people on it for weight loss, but it's known as an adrenal adaptogen, meaning that it will help balance your adrenals, whether your cortisol is going up or down. So look up stress formula that we make. I don't think they're going to have it in Australia. I don't even know if you can ship to Australia or not. If we can, but I'm sure they'll have some L-theanine. That's a good place to start out. Really like L-theanine, and that won't interfere with your sugar levels or anything either.
So L-theanine's a good place to start.
And the most natural thing you can do for stress is exercise. Get out.
Yep.
Stress your body out. And like I said before earlier tonight, I love Epsom salt baths. I think they're wonderful. Magnesium is great. That's why Epsom said, but you can take magnesium at night. I love that to relax you, help you sleep. So good luck with that. I hope you're okay.
Debbie, we're gonna be thinking about you in Australia. Keep us posted and let us know how you're doing next week when we see you Tuesday. Speaking of magnesium, Mark has a great question about the types of magnesium you like. Many people are now experiencing waking up at 2 a.m. and go back to sleep. Magnesium deficiency may play a role in regulating neurotransmitters and hormones that influence sleep. Which type of magnesium supplementation would you recommend?
I like magnesium glycinate is my favorite. Now, we have a magnesium that we put together from Freedom to Formulate, and it's got the glycinate, it's got the threonate and the malate. So those are my three favorite. If you're constipated, take mag citrate. But I'm not using, most of the time, I'm not using magnesium for constipation. I'm using it for helping sleep, relax. It prevents cardiac arrhythmias. So I really like, probably the one of all is the glycinate over any of them. If you use a combination, I think it's even better. But yeah, as people get older, most of them can go to sleep. They just wake up too early.
Yeah.
Sometimes, worse comes to worse, I'll use medications on that. I don't like to use Ambien. That's not a good drug, long-term use. Good short-term, maybe, if you're going on a flight to Australia. But, there's all kinds of different sleep things you can take. And when you take a powder like Calm or something, it's going to have magnesium in there. It's going to have usually some L-theanine in there too, GABA, valerian root, those type of things. But certainly you got a great point, Mark, and glycinate would be my favorite. My favorite's the one we make. It has no, cheap fillers in it. That's why we have these vitamins made for us out in Oregon, because it's safe. It doesn't have fillers in it. It's dated. It's tested 3 times.
Mark, that's such a great question. I think magnesium is super interesting because there's so many different types, and it's a
9
common
different
question.
types. There's 9 different types. Yeah, so you got to be careful.
Thank you, Mark, for that. I'm seeing Carter mentioned Ben Curtis did some great magnesium lotion, which is cool. I can see that being very relaxing as well. Carter, you taken is that for sleep as well, for stress? Let me know here. Thank you.
Yeah, you can put it on the bottoms of your feet. It's really absorbed well. That's why I like an Epsom salt bath. Those things, it's like taking a drug when you get out of there.
Yeah,
wonderful for you. And I also do a little red light before I go to bed.
To relax you?
Mm-hmm. Yeah.
Interesting. Mm-hmm. I wonder why that relaxes you. Is it the heat? Even though it's not that hot?
Red light doesn't produce any heat. When you add the near infrared, there's a little bit of heat that comes out deeper. But it activates your melatonin if you do it at night and then go to bed. It kind of makes it work better.
That's interesting.
Your body's own melatonin.
That's interesting. It seems Carter's using that for sleep. Cool. Yeah, that's awesome. I see. Excuse me, guys. I love this from Carter here. Got a report. I've been cold plunging for about 2 weeks, and it has changed my life. Huge shout out to Katie and Jody for the encouragement. Major difference in my stress levels and anxiety. That's awesome, Carter. I remember I talked with you about a week and a half ago where you had just started this routine of cold plunging, and you said it was very difficult to start, but once you got going, you could already tell some differences. That's so cool. That is so cool. Have you started yours?
Kelly got me a cold plunge for Christmas. I haven't used it a lot, man. You're right though, Carter. It's painful when you first start doing that. It's painful, but it's so good for you. So I have mine beside my infrared sauna. You can go get in the cold first and then go to your sauna.
Yeah, I love that. I think you're right. It's one of those things that you kind of have anxiety going into it, but it really helps you out. So many people have said the same thing, way more than like what we were talking about earlier with the hydrogen water, which
way
Katie, Katie was like just a $200 water bottle.
Felt like
with the hydrogen water.
I think she meant to say wasted $200.
Wasted $200.
Yeah.
Wasted $200 on a water bottle.
Yeah, I'm kind of like you on that.
I mean, I see this from Roel. I have to say, this book, Breath by James Nestor, was it was a life-changing book for me. It's hard to tell because I'm so stuffed up right now, but nose breathing really changed my life. Speaking of like anxiety, stress, breathing through your nose really helped me with that. Yeah. You did a podcast on this, didn't you?
I did a podcast on that book. Yeah, it's
on breath.
Great book. It'll really teach you how to do it. And Ben can actually do the rower for 10 minutes just doing nasal breathing. I can't do it. I just can't do it.
Yeah. It really is it's a muscle.
But I do it at night. I breathe through my nose at night because I tape my mouth shut.
Yeah, you still doing that?
Yeah.
Yeah. Mm-hmm. I'm trying to now.
You can't don't tape your mouth shut now, or you'll be able to breathe through your nose. I'll tell you a good tip on that, Ben. You can't breathe through your nose, use Afrin for just a few days.
I've thought about it.
Right up. It'll open you right up. Just try to get off of it, because get used to it, and you have to have it. So, but for a few days, you need it right now.
Yeah.
Take some Afrin while you have that. Open you right up.
I love this from Tom around holding your breath while lifting. I've heard about this. There are some methods where
Yeah.
you hold your breath while doing
Yeah.
either like a heavy lift. That's super interesting. That's right. I like that, Tom.
Yeah. It's kind of like that Kiatsu that I think that's what they call it. These blood pressure cuffs that you blow up to occlude the venous return while you pump iron.
Yeah.
You can really do way more with less weight. Peter Attia talks about that a lot. It's actually using cuffs while you lift.
I've heard that.
They're really hard to get around your legs, but on the arms and maybe calves you can do it. It's hard to get on. You can't do your lats or anything like that, or abdomen, or probably quads or hamstring, but your calves, biceps, and triceps really supposed to be pretty effective. I've never tried it. I just read a lot about it. You can order some of the special cuffs.
I've heard about that too. I think it's around, has something to do with lactic acid, I believe. Or no, nitric oxide. Sorry.
Nitric oxide. It's not lactic acid.
Yeah,
What some endurance athletes are doing now to get rid of lactic acid quicker, because that's your limiting factor when you're an endurance athlete, is using baking soda.
Like consuming
that's why they're setting these world records in the 400 meters. It was broken twice a couple weeks ago. I mean, by a minute. No kidding. I mean, just shattering. They're using. Yeah, they use baking soda. The problem, a lot of cyclists use it. Read about it. It's a major. I gave some to my brother before he ran his marathon.
And he just eats it in water?
Actually, because you could do it in water and just put a teaspoon of water, mix it up, and drink it. A lot of people complain of the gas it gives them. So this company in Sweden has developed the technology through these special packets. That's what I ordered and gave to him. I tried them, and I'm not doing enough strenuous endurance stuff right now to really notice a difference. So I just gave them to him, but because he's running marathons. But they're very effective. And the Swedish brand circumvents the GI distress that you're going to get if you just put baking soda in water and take it. You're going to get a lot of GI distress. So, which some people could tolerate, some people can't. But look it up. If you're an athlete, endurance athlete, look it up.
I see Esty Bestie's in here. Esty Bestie's in Thailand. Hello from America, Esty Bestie. We love you so much. She's over on Instagram and is asking, would a cold shower be comparable to a cold plunge? What do you say about this?
I like cold showers, and that's what I do after I get my infrared sauna. I always take a cold shower. It doesn't even feel cold, really, if you've been in an infrared sauna. But cold showers are good for you, no doubt about that. They're very stimulating, but it doesn't compare to a cold plunge.
Yeah,
I can tell you that. It just doesn't.
So the results wouldn't be similar either. Is what
no,
you're saying.
But still good.
Still
but
good.
not a life changing like Carter and Katie say.
Yeah.
I mean that water in there is about 53 degrees, and you're sitting in there, neck down for about 2 minutes if you can stand it. You did a cold plunge with me
at Mike's place.
Yeah.
Jasmine, thank you so much. I hope you're having a blast in Thailand.
Awesome.
Keep us posted.
Awesome. Have fun. That's supposed to be a great place.
I love it. I'm watching White Lotus right now, which is in Thailand. So if you see any of the White Lotus actors over there, say hello for me. I'm really enjoying this season 3. All right, we got a couple more questions here. Let's make sure. I want to get Max's, and then I'll get to ICD Lynn. What do you think of Slippery Elm?
Love it. I know Robin recommends it a lot for gut problems. Mostly for it's good for. Really, it's really pretty good for reducing inflammation in your gut.
Yeah.
So I do like Slippery Elm. You don't hear much about it, but it's definitely in my medicine cabinet. When I need it, I think it helps.
Yep. Thank you, Max, for that. Let's get to Jay over here on YouTube. Can PRP heal a partial rotator cuff tear. That's
It can
interesting.
help. Yeah, I've had my shoulder PRP'd. I've had both my knees. Even had my thumb one time. It didn't help my thumb much, but it definitely helped all the others. I love PRP. It's almost like your body's own stem cells. It's safe, and I think it can help. Ask Andy. My son Andy
Yep.
got it. I'm sure he had a partial rotator cuff tear. He got, his healed pretty quick.
It did.
Usually, if you have any age on you like me, it's going to take a month, 2 months maybe before you notice much. But it's certainly worth trying before you go in there and get that thing operated on.
Yep. Jay, thank you for that question. D. Lynn is saying my PCP is retiring. I had to choose another. Won't be seeing her till August. If I do telemedicine with you, will you prescribe a hormone? It seems D. Lynn was talking about hormones. If you think I will benefit, what's your thoughts on this, Doc?
Yeah, be glad to do telemedicine with you, depending on what state you live in. They've changed the rules, so you're supposed to be licensed in that state.
Yeah.
I'm licensed in Tennessee and Virginia, and I'm working on getting about 13 more. Ben's supposed to be working on that. Ben and Katie are supposed to be working on that, but they're kind of sleeping on the job, I think, because I haven't heard anything from them. Because, you're going to need testosterone. Testosterone is a control. So, you can't do, I can't call in that to a state that's not one I'm actually licensed in. I'm hoping they get rid of that and rule. We could do it for 4 years, but just in the last few months, when the COVID worries hit, then they put that old rule back into place.
She's in Virginia. She's Virginia.
Oh, well, sure I can. Oh,
Yeah.
right. Yeah, of course.
Thank you, D-Lynn, for that question. Guys, how do we do? This is our first week back in a couple weeks. We're going to be doing this every single week. I do not like missing a Tuesday and don't plan on it anymore this year. We'll see. We'll see what the schedule looks like.
You have a long streak going on. Have you missed a
did.
week in how many years?
We've taken off. We took off around New Year's last year, I believe. So every once in a while we will have to, if there's like a travel issue or something, we won't make it. But for the most part, we're here on Tuesdays at 7 Eastern, and we really appreciate you guys. I mean, there's been around 50 of you guys here the whole night. So we really appreciate y'all being here with us and letting us talk about health and answer questions. And, we love doing it. Thank you, Steve. Thank you, guys. Doc, how do you think we did? You think we did okay?
I think we did good from our little break. I think we're fresh. I think we got some great questions. Every question tonight was just a winner.
Yes.
They really asked some great questions. And
yes,
this is fun. Remember, we learn from you too. I learn a ton from my patients.
Yeah.
Because they know they can talk to me and I'll have time for them.
I think that's the big thing here is I hopefully everybody knows. Thank you, Ivy. Thank you, Elena. There is as much value happening in the comments as there are as what's happening on the screen or in your ears. So pay attention to the comments. A lot of people are doing things that are helping them. And, we say, health is so contextual and there's so many different ways to go about it. It's so personalized. So I love seeing in the comments what's working for people. So thank you guys so much for contributing and for being with us during this hour every week. To our team, I see, Katie, Carter, so Jasmine, Robin, Ivy, Angie. So many of our team was in here. We really appreciate you guys hanging out and being in the comments after a long day in the office. So if any of you guys who are with us live and you see someone on our team in the office, make sure you tell them thank you for all that they do. Should we call it a show?
Yeah, you need to go home and rest. You're getting a cold, so
no rest the voice.
Go use some Afrin. Double up on your C and go way up on your D. Take some ivermectin, methylene blue.
Should I take ivermectin? I took it yesterday. Andy was saying go twice a week, or should I take it every day?
No, when you're sick, you take it every day.
So every day. So I'll take ivermectin as well. And I'll talk with you about if I need to start an antibiotic or something. I don't think I do.
I don't think you do.
And this is the other thing that's kind of cool is like, this is like how Dad and I talk. So I just love that you guys are with us, and you guys get to do this with us every Tuesday. Yes, Katie, immune complex.
Immune complex. Yeah.
Taking it. I'm taking 3.
Good.
And the methylene blue. All right. I love you guys. Pop, I love you, man. Thank you for doing it.
Love you too. See you next week.
All right. We'll see you next week, guys. We will be back Tuesday, 7 p.m. Eastern. We'll be doing live Q&A. Outro, Brad. Where we at?
Don't go away.